What is the implication of prolactin levels with risperidone? If you are prescribing risperidone, prolactin is something you should at least be thinking about, even if you are not checking it routinely in every patient. Risperidone is one of the antipsychotics most strongly associated with hyperprolactinemia because dopamine normally inhibits prolactin release, and D2 blockade in the tuberoinfundibular pathway removes that inhibition. Clinically, that matters because prolactin elevation can lead to menstrual irregularities, galactorrhea, sexual dysfunction, decreased libido, infertility, and in some patients, gynecomastia. Longer-term concerns include hypogonadism and reduced bone mineral density, especially if the elevation is persistent and clinically significant. Now, the important nuance is that most guidelines do not recommend routine prolactin monitoring in asymptomatic patients. That is why this is usually approached as symptom-driven monitoring rather than automatic serial lab testing for every patient. So when should you check it? You may ask. You check prolactin levels when the patient has symptoms, when there is strong clinical suspicion, or when the history raises concerns about complications from long-term elevation. The presence of symptoms should trigger testing, and if prolactin is elevated, you do not just react to the number in isolation. You interpret it in context and consider other causes such as pregnancy, hypothyroidism, chronic kidney disease, and pituitary pathology. And management depends on the situation. If the patient is asymptomatic and the elevation is mild, you may monitor it clinically. If symptoms are significant or risk is higher, options should include reducing the dose, switching to a prolactin-sparing antipsychotic, or adding low-dose aripiprazole. Recent umbrella review evidence still supports adjunctive aripiprazole as best supported pharmacologic strategy for antipsychotic-induced hyperprolactinemia, including risperidone-related cases. So the implication of prolactin with risperidone is this. Not every patient needs routine lab monitoring, but every prescriber should know the symptoms and ask about them, and know when a prolactin level would actually change the course of management. Thank you for listening, and I hope to see you in my next video. Take care.